Good afternoon. My name is Erin Giddens, and I'm the Program Manager for the Veterans Benefits Administration's Homeless Veteran Program. After this presentation, you will be able to reference basic information about VA and how veterans can access benefits from VA, state the reasons that homelessness impacts veterans, demonstrate knowledge of VA's mission to end veteran homelessness, locate resources to help homeless and at-risk for homeless veterans, and understand how you can support and guide veterans who may be using resources within your library. The U.S. Department of Veterans Affairs, or VA, has a noble mission to fulfill Abraham Lincoln's promise to care for him who shall have borne the battle, and his widow, and his orphan. VA is comprised of 3 administrations: the Veterans Health Administration, Veterans Benefits Administration, and the National Cemetery Administration. VA offers a range of benefits and services including health care, compensation, pension, education, home loan guarantees, insurance, burial, and more to qualifying veterans as well as survivors and dependents. A veteran is defined by VA as anyone who has served on active duty in the armed forces and has received a discharge characterized as other than dishonorable. Today we're going to focus on ways VA is working toward ending veteran homelessness and resources you can use to help veterans in need. The VA has made ending homelessness among veterans a top priority, undertaking an unprecedented campaign to dramatically increase successful outcomes for veterans and their families who are homeless or at risk of becoming homeless. Our goal is a systematic end to homelessness, which means there will be no veterans sleeping on our streets and every veteran has access to permanent housing. Should veterans become at risk for becoming homeless, we will have the capacity to quickly connect them to the help that they need to achieve stability. The ultimate goal is that veterans have permanent, sustainable housing with access to high-quality health care and supportive services. The label homeless can be difficult for many people to use and understand. In many ways, this term has come to be a label for people replacing their identity. However, it is really only a description of a particular and frequently temporary housing condition. VA considers a veteran to be homeless if the veteran self-identifies or gives us information that they do not have housing. VA considers the veteran at risk for homelessness when they report that they are facing eviction, foreclosure, or at other imminent risk of losing their nighttime residence. VA, together with federal, state, and local partners, has made steady progress towards preventing and eliminating homelessness among veterans. The 2014 point-in-time count, which is prepared by the U.S. Department of Housing and Urban Development, or HUD, estimates that there were 49,933 homeless veterans on a single night in January of 2014. In 2016, that number was less than 40,000. This number represents an approximate 50% reduction in veteran homelessness since the initiative began in 2010. Veterans are overrepresented among the homeless population. The 2014 data from HUD shows that although we make up 9.5% of the U.S. population, we account for 13 to 16% of the homeless population. The good news, however, is that strong interagency collaboration is resulting in successful policies and programs, such as Housing First, Rapid Rehousing, HUD VA Supportive Housing, and supportive services for veteran families, to name a few. The vast majority of homeless veterans, 96%, are single males from poor, disadvantaged communities. Homeless veterans have served in every conflict since World War II, as well as during peacetime. The number of homeless female veterans is on the rise. In 2006, there were 150 homeless female veterans of the Iraq and Afghanistan wars. In 2011, there were 1,700. That same year, 18% of homeless veterans assisted by the VA were women. Comparison studies conducted by HUD show that female veterans are 2 to 3 times more likely to be homeless than any other group in the U.S. adult population. Veterans between the ages of 18 and 30 are twice as likely as adults in the general population to be homeless, and the risk of homelessness increases significantly among young veterans who are poor. Roughly 56% of all homeless veterans are African American or Hispanic, despite only accounting for 12.8 and 15.4 of the U.S. population, respectively. About 53% of individual homeless veterans have disabilities, compared with 41% of homeless non-veteran individuals. Half suffer from mental illness, 2/3 suffer from substance abuse problems, and many from dual diagnosis, which is defined as a person struggling with both mental illness and a substance abuse problem. Homeless veterans tend to experience homelessness longer than their non-veteran peers. Veterans spend an average of nearly 6 years homeless compared to 4 years reported among non-veterans. So what is the primary cause of veteran homelessness? Poverty, lack of support networks, and dismal living conditions in overcrowded or substandard housing are the top causes. About 1.5 million veterans are considered at risk of homelessness. At risk is defined as being below the poverty level and paying more than 50% of your household income on rent. It also includes households with a member who has a disability, a person living alone, and those who are not in the labor force. Research shows that one of the greatest risk factors for veteran homelessness are lack of support and social isolation after discharge. Veterans have low marriage rates and high divorce rates, and currently 1 in 5 veterans is living alone. Social networks are particularly important for those who have a crisis or need temporary help. Without this assistance, they are at high risk for homelessness. Nearly 500,000 veterans are severely rent burdened and paying more than 50% of their income for rent. More than half of veterans with severe housing cost burden fell below the poverty level, and 43% receive food stamps. Approximately 45% of the 1.6 million veterans from Iraq and Afghanistan are seeking disability compensation. The average wait time to get a disability claim processed is now 90 days. Payments for disability compensation from the VA range from $127 a month for a 10% disability and $2,769 for a full disability. As librarians and library staff, you know that people who are homeless often use libraries as a key information resource and source of safety and security. You also know that libraries are most successful in providing services to homeless patrons that are aligned with their general mission and purpose. Librarians and library staff like you can play an important role as information intermediaries and as partners of supporters of service organizations like VA in facilitating access to housing, medical care, and other needs of homeless veterans or at-risk patrons. Library programming is a popular service for all patrons. For the most part, people who are homeless want the same programming as other library users: computer classes, educational workshops, story times, arts and crafts, and social activities. Reference can be among the most essential services librarians can provide, and it should be one of the key pieces in serving library users who are homeless. Information of most need to people who are homeless or in jeopardy of becoming homeless may include where to find shelter, food or a shower, accessible medical care, help in finding employment, or how to find a professional that can help stop an eviction or foreclosure. The key homeless veterans programs involve a 4-pronged approach: health care, mental health care, housing assistance, and employment. If a homeless veteran is in need of immediate assistance or is at risk of becoming homeless, VA's toll-free National Call Center for Homeless Veterans at 1-877-424-3838 or 1-877-4AID-VET is here. There is a free online chat available and tons of information on VA's website for homeless veterans at va.gov/homeless. The hotline and online chat are free, and neither VA registration nor VA healthcare enrollment is necessary to use either. The Veterans Health Administration is America's largest integrated healthcare system with over 1,700 sites of care, serving 8.76 million veterans each year. VA's Homeless Veteran Program is a collaborative interagency effort, but is managed through VHA, the Health Administration. VA healthcare facilities include hospitals and clinics all over the country. This VA facility locator makes finding the nearest VA healthcare facility one click away. Under the healthcare section of the Eliminating Homeless Veteran Program is the Community Resource and Referral Center. These are a collaborative effort of VA, the community, service providers, and agency partners. The CRRCs are located in strategically selected areas to provide both a refuge from the streets and a central location to engage veterans in services. It is essentially a one-stop center for homeless veterans services. Domiciliary care for homeless veterans provides time-limited residential treatment to homeless veterans with mental health and substance abuse disorders, co-occurring medical concerns, and psychological needs. Health care for homeless veterans is an outreach service that engages veterans and connects them to health care and other needed services. Case managers ensure that chronically homeless veterans, particularly those with mental health or substance use disorders, can be placed in quality housing programs that meet their needs. Health care for reentry veteran services is a program designed to address the community reentry needs of incarcerated veterans. The goal is to prevent homelessness and reincarceration. Homeless patient-aligned care teams. Clinics are co-locate medical staff, social workers, mental health and substance use counselors, nurses, and homeless program staff. These professionals form a team that provides veterans with comprehensive, individualized care, including services that lead to permanent housing. The Homeless Veteran Dental Program helps increase the accessibility of quality dental care to homeless and certain other veteran patients. The Veterans Crisis Line connects veterans in crisis and their families and friends with qualified, caring Department of Veterans Affairs responders through a confidential, toll-free hotline, online chat, or text. Veterans and/or their loved ones can call 1-800-273-8255 and press 1. They can chat online or send a text message to 838-255 and receive confidential support 24 hours a day, 7 days a week, 365 days a year. VA Substance Use Disorder Treatment Enhancement Initiative provides substance use services in the community to aid homeless veterans' recovery. MakeTheConnection.net is a comprehensive site for veterans with PTSD or other mental health disorders to connect with other veterans and find resources for treatment and support. Housing and Urban Development Veterans Affairs Supportive Housing, or HUD-VASH, is a collaborative program between HUD and VA where eligible homeless veterans receive a housing choice rental voucher from HUD, paired with VA providing case management and supportive services to sustain housing stability. This program subscribes to the principles of the Housing First model of care, which demonstrates rapidly moving individuals into housing and then providing the supportive services to improve their housing stability. Acquired Property for Homeless Veterans is a program that makes all of the properties VA obtains through foreclosures on a VA-insured mortgage available for sale to homeless provider organizations to shelter homeless veterans. The mortgages are offered at a discount of 20 to 50% based on how long the property has been listed for sale. Project Challenge has two components: a challenge survey in which participants rate the needs of homeless veterans in their local communities, and challenge meetings which encourage partnership development between VA and community service providers. The results of the challenge survey are then used each year to identify unmet needs and encourage new partnership developments to meet those needs. The Grant Per Diem program funds community-based agencies providing transitional housing or service centers for homeless veterans. Through the program each year, as funding is available, VA offers grants that may fund up to 65% of the project for the construction, acquisition, or renovation of facilities, or to purchase vans to provide outreach and services to homeless veterans. Home loan guarantee is a VA benefit that guarantees a lender that if the veteran were to default on a home loan, VA will buy the property. If a veteran is at risk of homelessness and has a loan with a VA loan guarantee, VA can oftentimes work with the lender to avoid foreclosure. VA's Compensated Work Therapy Program is comprised of 3 unique programs which assist homeless veterans in returning to competitive employment: sheltered workshop, transitional work, and supported employment. Veterans in CWT are paid at least the federal or state minimum wage, whichever is higher. Vocational Rehabilitation and Education is a VBA program that provides rehabilitation and education services to veterans who have a disability as a result of their military service that prevents them from doing the same work that they were previously able to do. The Post 9/11 GI Bill is a program that veterans can use to pay for tuition, fees, books, as well as a housing allowance while they are in school. Homeless Veteran Community Employment Services coordinates efforts between VA and non-VA employment programs, federal and state agencies, and local employers to improve employment outcomes for veterans who have experienced homelessness. Community employment coordinators for homeless veterans are available at more than 120 VA medical centers to assist employers with hiring veterans. You can learn more about the Homeless Veteran Community Employment Services program and find the contact information at your local VA medical center. Veterans Benefits is responsible for processing claims for benefits for disability compensation, pension, education, such as the GI Bill, vocational rehabilitation, insurance, and home loan guarantee. VA has a commitment to reach veterans and educate them about these benefits and has a duty to assist the veteran in filing claims for those benefits. VBA is mandated specifically to reach out to veterans that fall under certain special emphasis groups, which includes homeless and justice-involved veterans. Veterans may be eligible to receive monthly compensation for a disability that was incurred in or caused by their military service. Veterans may be eligible for pension if they are disabled and served during wartime. Pension is income-based. There are several life insurance programs that veterans may be eligible for as well. Veterans can learn about these programs on the VBA website listed here. Every regional office across the country has a homeless veteran coordinator that can assist homeless veterans with filing or expediting a claim, as well as connect them to the community resources. Regional offices have town halls where the public is invited to attend and can get a claim and healthcare eligibility assistance on the spot. Claims clinics are held quarterly in each regional office and offer on-the-spot assistance with claims, healthcare eligibility, as well as education about additional benefits. These are usually held at a location outside of the regional office in an attempt to reach veterans that are unable to travel to their local VBA office. By going to this locator, a veteran can find their local regional office with one click. Veteran Service Organizations is an official representative who can help a veteran apply for and access the benefits and services they are entitled to once the veteran gives them power of attorney to act on their behalf. VSOs have been trained to support veterans and can help the veteran navigate the sometimes complicated benefits applications process. Veterans can find and partner with a VSO by visiting the site listed here or contacting them directly or by contacting them through e-benefits. For additional information about homeless statistics, programs, and upcoming events, you can check out the National Center on Homelessness Among Veterans website. Safe Havens is a 24 hours a day, 7 days a week, community-based early recovery model of supportive housing that serves hard-to-reach and hard-to-engage veterans with severe mental illness and/or substance use disorders. Stand-downs are community events where homeless or at-risk veterans can go and get assistance with health care, benefits, and a host of other services. Under the Supportive Services for Veteran Families, VA awards grants to private and nonprofit organizations and consumer cooperatives who can provide supportive services to very low-income veteran families living in or transitioning to permanent housing. The purpose of the Veteran Justice Outreach Program is to avoid the unnecessary criminalization of mental illness and extended incarceration among veterans by ensuring that eligible justice-involved veterans have timely access to VHA services as clinically indicated. Veterans Justice Outreach Specialists are responsible for direct outreach, assessment, and case management for justice-involved veterans in local courts and jails, and liaison with local justice system partners. The main takeaways. As a librarian or library staff member, you may come into contact with veterans who are homeless or are at risk for homelessness as they visit your library. There are a number of emergency and long-term resources for veterans who are at risk for homelessness. Veterans can work with VA or a veteran service organization to help them access the benefits they deserve. VSOs can help connect veterans to VA sources, resources, and services that they need at no cost to the veteran. Help inform veterans who are homeless or at risk of homelessness visiting your library that there are ways that they can get help through the VA. Help patrons find helpful VA resources and content online or connect them to other crisis line information. And finally, encourage them to find and use a veteran service organization to support them with all of their VA needs. Before we answer any questions on the webinar today, I'd like to play a special video.
I'm Chris Gardner. I spent some of the best years of my life in the United States Navy, specifically in the U.S. Navy Hospital Corps.
I need you out of here in the morning.
Being a homeless father who was also a veteran with a toddler, my son was 14 months old. He was still in diapers. We were homeless, but we were never hopeless. As long as I was going forward, I knew that we would be okay. People ask me often, how did you become homeless? Was it drugs? No. Was it alcohol? No. There's something just as lethal as both. It's called life. Life happens. One of the things that I think we need to look at as a society, as a country, is how can we help facilitate the transition from homelessness to a home? I think one of the first things that everyone in our country can do is to accept around our communities and say, what can I do? Not, well, the government should do this, or the city should do that, or this organization should do. What can I do? You better hit that Channel, Arizona, Origami Owl, to send you all a check for $5,000. And this money is specifically to be used for women in this group. Okay? God bless you. Thank you. Good for your gift. God bless. One of the things that I would encourage all veterans to do is learn what resources are available at the Veterans Administration. There are now specific programs to help all veterans, men and women, address this issue. What resources are available? It's no different than being in the field. You go in the field, you're on a mission, you're on an assignment. You got to know what's in my bag, the equipment, the resources. What do I have? Not what do I not have. That's a whole different question. But what do I have? And to reach out to people at the Veterans Administration and be clear. I'm not here because I'm looking out for a handout. I'm here because I'm a veteran. I'm here because I paid and was willing to pay the ultimate price. And my family and I, we need help. And that's what I'm hoping to do with the stand downs across the country. We need to know there's a debt that's owed to our veterans. It should be honored. Our veterans returning home from these wars all over the planet, conflicts all over the planet. You should not be a hero in Afghanistan and homeless in America. I'm going to try and enlist everybody in this country on this one issue, ending homeless veterans. Thank you.
Okay. Do you have any questions?
We don't have any right now, but we can give everybody a few minutes to type in any last-minute questions they might have. Okay, if there are no other questions, we can conclude today's webinar. I would like to thank everyone again for joining us, and a special thank you to Erin and the Department of Veterans Affairs. Remember that this webinar will be archived, so you can go back and view it at a later date, and enjoy the rest of your day.